All right, y'all. So today we're gonna be hitting the ground running with a lot of news haven't covered this week, and today we're gonna start off with the deadly wildfires that's been happening in Texas. Now, if you don't know, basically several wildfires have kicked off this week, with one growing to be the largest in the state history. That is the Smokehouse Creek Fire that was ignited in Hutchinson County. I'm gonna show a map in a few minutes. That has remained active through Thursday and probably into the day. It has only been 5% contained. Flames, which cover an area larger than the size of Rhode Island, have spread across state lines and has burned more than 1 million acres across Texas and about 25,000 acres burned in Oklahoma. And at least 2 people have been unalived due to the fires. Basically, Cindy Owen, 44, from Amarillo, who had been making deliveries, was caught in the Smoke Creek House fire. Another 83-year-old woman unalive in Cited, Texas, earlier this week, according to the Associated Press. The family identified her as Joyce Blankenship, a retired school teacher, and said she was found in her burned out home. The other fire that is still active across Texas is the Winnie Deuce fire that ignited in Moore County. Was also still very active and having burned about 142,000 acres and has been about 50% contained. So a lot better than what the Smokehouse Creek fire is right now. But at the end of the day, it is still running rapid, along with the Grapevine fire that ignited in nearby Gray County, had burned an estimated 30,000 acres and was 60% contained as of early Wednesday. It's just giving a good comparison about the area and size of these fires. They are right here just north of Amarillo. This is a Smokehouse Creek fire. Like I said, it has burned about well over 1 million acres. Winnie Deuce is about right here, and then Grapevine Creek next to Pampa and White Deer, just east of White Deer, and near east of Panhandle. They are experiencing wildfire there as well. And just to give a good estimate about just the Smokehouse Creek fire, like I said, it is big as Rhode Island. It's larger than Rhode Island, and it is almost half the size of Connecticut as just, a comparison of it. So when we're talking about just devastation and just, how big these fires are, like, 1 million acres, be like, oh, that's just like that made up number, whatever. But it's actually a lot of land. Like, obviously it's a lot of land, but like, just to put it in comparison to like states, this is like how big and devastating it is. And as you're talking about acres getting burnt up, there's not only impact on human lives or just like vegetation, all that. It also has impact on livestock, since a lot of livestock is in Texas, especially in the Panhandle up north. And basically ranch that is being heavily impacted is Turkey Track Ranch, a 120-year-old 80,000 acre private property located along the Canadian River in the Texas Panhandle. It is very historic. It has been up for sale and listed about $100 million. And pretty much their early estimates estimate that the ranch has suffered and lost approximately about 80% of their pastures, plains, and creek bottom vegetation. They're going to continue to assess the total damage to other infrastructure and loss of livestock, but I'm guaranteeing you that is like millions of dollars just literally burnt up in flames, just talking about how much value and just history that was there. But a lot of that is due to the unseasonable warm and windy weather. Texas weather is a meme. Like, you don't know what season you're going to get on what time of day, but we have uncharacteristically gotten summer like weather. And just look at the forecast right here. Temperatures in the Texas Panhandle are forecasted to surpass 70 to 80 degrees Fahrenheit from Friday through Sunday, while wind gusts could be 30 to 45 miles per hour. So these are prime conditions for these fires to spread. One thing I would say, definitely I always joke about pray for Texas. We going through a lot, where it be politics or it'll be like different emergencies, whatever. But definitely pray for us in this situation, because, definitely, it's a fortunate incident where people have lost their lives, livestock, have been up in flames, and basically people have lost like entire homes, livelihoods and stuff. And it's just like, just definitely pray for people affected by it, and just like keep us in the prayers, because this is going to be a long, wildfire season if it keeps happening like this. Now, going on to another unfortunate news, basically more than 100,000 mouthwash bottles are being recalled nationwide due to increased poisoning risk. The Consumer Product Safety Commission announced recall Thursday, saying in part that the hydrogen peroxide mouthwash in question were not sealed with proper childproofing. And this goes to 102,000 bottles of Heritage Store hydrogen peroxide mouthwash that was sold between October 2010 to December 23rd. according to the recall notice. And the reason why it's getting recalled in question is because it contains enough ethanol to require child safe packaging. But those affected unit did not have child resistant, packaging or like the caps, and that is a violation of the Poison Prevention Packaging Act. And so if you need a little image about what this looks like, this is it. If you have this bottle, please, take it back. If it wasn't a recall date, pretty much they were served at or sold at Whole Foods, Fresh Time Farmers Market, Mom's Organic Market, New Seasons Market, Mother's Market and Kitchen, and other stores nationwide and online, such as Amazon, iHerb, Heritage Store, and other websites for about, 10.50. So as well as these are the signs and symptoms of ethanol poisoning: vomiting, confusion, seizures, slow irregular breathing, trouble staying awake, and low body temperature. And so if your child has been experiencing that and you had this bottle, that is probably the main cause of it. And definitely seek medical attention or contact poison control at this number right here. I'm also going to put down a recall notice in the description below for you to look at in yourself. But other than that, please stay safe out there. Please listen to the recall notice. I know it's one of those silly things where it's just like, oh, it will never happen to me, but then you have your child in the hospital due to ethanol poison that could have been prevented. So please do that. More good news I wish I covered earlier in the week. Basically, the Einstein College of Medicine is to offer free tuition after $1 billion gift. This made waves into the healthcare public health world because it is the largest gift that a medical school institution has received ever in the history of the U.S. As well, it is based in the Albert Einstein College of Medicine, which is based in the Bronx, which is serving a disproportionate minority population of Black and brown Americans. And so definitely this is a huge gift, because the thing with medical institutions, they provide a lot of healthcare, a lot of like support, or supposed to provide support in the community. Sometimes they provide more harm than good. But in the theory of things, medical institutions are like a pillar in the community that provides a lot of support. And so giving this gift for medical students to go there to like study for free is a really big deal. Now, the sponsor behind this is Dr. Ruth Gottsman, 93, who spent 55 years as a chair of the school board, made a historic donation in her name of her late husband, David Sandy Gottsman, who was an early investor of Berkshire Hathaway and a longtime friend of Berkshire's famed CEO, Warren Buffett. Gossman has passed away at 22, but basically he and his wife had been long philanthropists in the healthcare, space. Basically, they did a $25 million gift to the College of Medicine that went towards creating the school's Institute for STEM Cell Research and Regenerative Medicine. Just looking at Dr. Ruth Gossman's history, she joined the medical school in 1968 and developed screening, evaluation, and treatments for children with learning disabilities. In 1992, she founded the adult literacy program at Einstein's Children Evaluation and Rehabilitation, the first of its kind. And she also served as the founding director of the school's Emily Fisher Launder Center for Treatment of Learning Disabilities, which opened in 1997. And the reason why this is important is that, medical students, while they are brilliant, while they might get financial help, why they are providing good to society, and while they might go off and make a lot of money at the end of the day after they get out of medicine, medical students still accrue a lot of debt that they take years and years to pay off, and a lot of stress that, they don't need for providing a benefit to society, in my personal opinion. Basically based in an October survey from the Association of American Medical Colleges, found that 70% of medical students who graduated in 23 have taken on some level of educational debt. A lot probably, was taken before this graduating year. Because the average graduate left medical school owing more than $200,000, according to AAMC. And another reason why this is important is that we are experiencing a physician shortage that is going to get worse and worse as the years go by. As data published by the same association estimates that the U.S. could see a shortage of 54,000 to about 139,000 physicians by 2033. And that basically spans not only the primary field, but also the specialty care fields like, oncology, dermatology, cardiology. Basically, every part of the field is going to experience some type of shortage, not only just with physicians, but also in nursing too. But today we're just talking about doctors. And to further concur this point, basically a September 2021 report from Kaiser Family Foundation noted that 84 million people live in a designated primary care health professional shortage area, and more than 14 or 15,000 practitioners are needed to remove this designation in these areas. And so when you're looking at the drivers of this situation, a lot of times it's just like the way that we do medical education here is a very costly and very, taxing process. Basically, there's a lot of time included into it. I know med students, they spend most of their hours studying, going to clinical simulations, and really like not seeing them for a lot of semesters or a lot of time during their semesters because they're so busy. There's a cost, like I mentioned in the last article, and availability of just medical training in general. Basically, medical school is so competitive, and it to the point where it's just, you know, not everybody's going to get a spot, even though some people who deserve a spot, who will make great doctors, don't get that spot. And a lot of times it's not necessarily due to the fact that they're not have the abilities to become a doctor. It's just due to seating and just spots they have in medical institutions. Not only that, you also got postgraduate training. Basically, internships, residencies has also limited number of physicians who can enter the field each year. Basically, residencies are very competitive. I know a few people who are trying to fight tooth and nail to get in the residency that they want to, and you know, sometimes they make it, sometimes they don't make it. And we consider the fact that by 2025 or 2035, there will be more seniors age 65 and older than children age 17 or younger. This is going to be the first time this, you know, imbalance in demographic has occurred. And when you consider the fact about geriatric care, basically the population has a lot more healthcare issues. They need a lot more healthcare love and attention and stuff. We're going to need physicians to fulfill that gap. And if we're already having a shortage right now, when, you know, that imbalance is not taking place, is only going to get worse, you know, about time that imbalance takes place in the next, you know, about 11 years. And it's going to get to a point where, you know, this U.S. healthcare system won't be able to, you know, actually take care of some of its, you know, older residents. As well as one of the most recent examples of why people are being driven out the field is more like burnout, especially during the pandemic. And what a lot of people didn't really understand, especially people who caught COVID and just stayed at home, didn't understand the spike that happened in the hospitals, because literally like the reason why you've seen so many nurses and seen so many doctors quitting is because there was not only just, you know, 1 month where it was just packed out, you know, where they had to like, you know, make beds or just like put beds or put everybody on ventilator, or just like how to figure out how to like, you know, make do with scarce equipment, you know, for just like a little period of time. It was a sustained period of time that happened for months and months and months during the COVID pandemic. You know, I think for at least a good 6 months, you know, before the, you know, the vaccine came out. And even then we've had spikes and spikes of spikes, not only just COVID, but also flu and RSV, you know, making this trindemic that we're going to be pretty much seeing, you know, every, you know, year until we get this stuff under control. And so that caused a lot of trauma, a lot of stress, like, you know, seeing patients actually pass away in front of your eyes and you can't do much about it, or seeing patients living their last moments that, you know, they couldn't see their families, you know, they had to communicate them on FaceTime, whatever. That caused a big issue in our healthcare system, where a lot of people didn't want to do this job anymore. And that's why gifts like this is so important. Like, it's not going to fix everything. Like, I don't think, you know, this is going to be a magical wand that's going to like fix the whole healthcare system. It's going to take a multi-pronged approach, funding from government, expanding residency positions, as well as like rethinking about how we do medical education in the U.S. But at the end of the day, this is the first step in addressing that. Hey, we need to reduce the stress and burden off these, you know, kids, these students, I should say, and, you know, make it to where they're able to like go to school without worrying about debt free, because they are going to be providing some type of benefits to society. Whether or not you think it's worth it, that's your opinion. But at the end of the day, it's just one of the things that we need more doctors, we need more physicians, we need more young people get into the field, because, you know, our healthcare field is on the verge of collapsing. But with that rant over, this has been Pot Help for today. This is a little format I'm thinking about doing more often, you know, not just doing one-off news stories every day and you just getting random posts through me about the week, but maybe on Fridays or Saturdays I post like the most news stories throughout the week. And, you know, it just gives you not only more to watch at one time, but also too, it makes it easier for me to create these videos. So if you mess with it, please like, subscribe, turn on post notifications, share this with people out into the algorithm, all that, boost the channel up. As well, if you like this video, please go like this video right here, watch it, you know, thumbs up, all that wonderful good stuff. Stay warm, stay safe, depending on what part of the country you're in, and peace out.